Chief of Dharamshila Narayana Super Specialty Hospital, Delhi. And he is also our ZNMC alumni. And he is a gold medalist with more than 2 decades in the field of oral and surgical oncology. A celebrity whose life is dedicated to spare awareness against cancer. And a popular face on social media, especially for television and newspaper, and a yoga scholar himself. And today I'd like to invite Sir to present the topic of midlife crisis. This is a very unusual topic, so I would like to hand over mic to the Sir itself.
Before starting the lecture, for Anshuman sir, I would like to request Dr. Rajat Pratap Singh to kindly welcome our guest speaker by presenting a bouquet to him. Thank you, Dr. Rajat, for doing the honors, and all over to Anshuman sir for the presentation.
ये आपका तो अटैच हो गया, ये आप उसके आ गए, ये स्क्रीन पे आ रहा है, ये आ रहा है, हाँ तो ये आपने जो इसका आप अपने लैपटॉप को देखिए आपको ये.
And this session will be chaired by Dr. Abdul Bari.
मेरा तो यहाँ पे अटैच हो गया, लेकिन ये उसमें तो डिस्प्ले आ गया था, एक सेटिंग में कुछ होता है तो कोई है नहीं ये जो डिस्प्ले इसका है डिस्प्ले क्यों नहीं आ रहा
सर एक बार निकाल के केबल को दोबारा लगाइए.
सही कह ऐसा ही कुछ होता है इससे तो अटैच हो गया ये.
अब खोलिए अपना प्रेजेंटेशन, इसको स्क्रीन मोड पर उस पर लाइए, फुल स्क्रीन पे यहाँ पर. ठीक
Unfortunately, we don't have a caller mic, sir.
Good evening and thank you, Aligarh. Dr. Astha especially, who chosen this topic, midlife crisis. And Dr. Yagma, you already introduced a kind of physical pain that's a part of crisis, not the entire crisis. To understand midlife crisis, first we have to understand what is mid, and then what is life, and then what is crisis. Madhya Jeevan Kal ka Sankat. First we have to understand Jeevan, what is life. One concept can be, being a doctor, we can understand formation of zygote, delivery of a boy or girl after life starts. That's purely biological theory. But there are many lives in one life. पुनर्जन्म की बात मैं नहीं कर रहा हूँ. We have many lives. That's the reason it's not called mid-age crisis. It's mid-life crisis. These are the points I'm going to highlight. First definition. Exactly speaking, 1965, Jacks tried to define it, but till date, actually first definition is not well defined. What is midlife crisis? Age ranges from 35 years to 65 years, but average out, it is between somewhere between 40 to 60 years of age. Emotional turmoil in the middle age, number one criteria. That's a purely emotional. A strong desire to change whatever you have been doing. Let's say your daily routine, it's your lifestyle, your practice, your job, anything. Desire to change. Midlife experience, it's inner turmoil about your identity, life choices, and mortality. Life choices can be anything. Settling down in a city, marrying a girl, anything, you can question that. That's a mnemonics USA. Combination of unhappiness scared and agitated, and this will be sudden onset, not kind of ongoing process after means for a longer duration. Midlife, as I told you, it's not mid-age crisis. At prime of life, when you have achieved basic degrees, married, settled, children, car, and everything you got, then it's the prime of your life. Only then you can face this kind of emotional turmoil. Adults usually reach full maturity. If it is happening below maturity age, it's not midlife crisis. Their duties got more complex, professional, personal, social, and many things. Becoming a crisis if middle-age development problems and challenges remain unresolved. There are certain chaos and confusion in your daily life. That is the time when you can face this midlife crisis. Differ from person to person as well as gender. It's a very important. Both the gender have different kind of crisis. Marked by strong feeling, unhealthy coping skills, and behavioral changes. Can be stressful and confusing time. Can also be time of growth, stability, and joy when you have done all the things. And actually, it's the midlife reawakening. It's not a crisis. These are the common signs. When you find in yourself or anybody else close to you, deep sadness and regret, restlessness and daydreaming, irritability, nostalgia, impulsive and indulgent behavior, and changes in ambition. These are the usual signs. Compulsive attempts to remain young. This is the most common usual presentation or manifestation in midlife crisis. Hypochondrial concern over health and appearance. Hollowness and lack of genuine enjoyment in life. Increased religious concern. Non-believer, atheist, and agnostic. They all become religious when they enter into midlife, maybe because of fear of mortality. Intellectual dishonesty and weakening of moral fibers and courage. हो सकता है उसके पहले बहुत कहता होगा कि ये सही है गलत है ethics की बात करता होगा. In midlife, all ethics gone. Increasing feeling of ruthlessness. Fantasy of omnipotence and omnipresence. सर्वशक्तिमान and सर्वव्यापी. ये दोनों की फीलिंग्स आने लगती है. तो ऐसे व्यक्ति हर समय चाहेगा हर शादी को अटेंड कर ले, हर फंक्शन को अटेंड कर ले और हर चीज का सॉल्यूशन उसके पास है, ऐसा दिखाएगा. Changes in sexual desire, sometimes having double lives, triple lives, and lives lived for compartments. There are many compartments when any male or female enter into midlife crisis. There are multiple bubbles in their life, and each bubbles are unaware about another bubble. What are the litmus tests for midlife crisis? How you can test it? Dissatisfaction in a relationship. This is the first thing. Have an affair, purchase a brand new car. Obsessive care with one's appearance, and that too in recent change. Like uses capsule, changing eating habits recently, exercising, using many cosmetic products, trying this, trying left, right, occupational dissatisfaction, and emotional pain. These are the findings you can test it in yourself and others. How we can differentiate between midlife crisis and depression? Depression is absolutely different. Depression can happen at any age, unlike midlife crisis. Its biological, psychological, and social factors are responsible for depression, but not midlife crisis. More persistent and severe, and treatment is medication. But midlife crisis is self-resolving, it will go. What are the factors affecting midlife crisis? Culture. Indian subcontinent midlife crisis is different. European is different, American is different, Australian is different. Different part of the world, different crisis. Custom, family type. Nuclear family has more midlife crisis problem than joint family. Gender, female and male both have different type of symptoms in midlife crisis. Working and non-working female. Previous part of life, previous trauma, especially childhood trauma, and digital toxicity in today's era. If you have seen someone posting social media, visiting Sweden and going for family trip, you start developing some kind of regret, repent, something like that. That may be a problem. These are the common 5 components in both men and women. What kind of symptoms they face. This is a graph of human life. Youth, late adulthood. From youth, when you ascend up, there is a chance of getting something and achieving something. And you have enthusiasm, जोश है, लेकिन होश नहीं. You have a hope. When you enter late adulthood, there is declining path. You are progressing towards disease and death, seeing your near dear, your family dying. And where these two graphs meet, that is actually midlife. It's not mid-age. Someone can get experience early, some can late. This is U-shaped happiness curve of human life. Just you see, when we were in college, जब अलीगढ़ कैंपस में थे, तो जकरिया का सब मैक्सिमम एमी के होंगे. जकरिया का आमलेट मछली खा के भी हम खुश हो जाते थे. Inadequacy. And when we progress, abundance. बहुत सारी चीजें हमारे पास हो जाती हैं. But actually midlife के बीच में you have abundant amount but lowest happiness. That is midlife. When you progress beyond midlife, your requirement will go down and happiness will go up. That's the vanish point of midlife. You remember this graph. This is U, always U shape. Abundance and lowest happiness. This is a common dictum. You can't have midlife crisis if your entire life is a crisis. Like those who are struggling for basic need of, as per Maslow's, Katarya साहब बात कर रहे थे, Maslow need hierarchy theory. Basic need, food, safety. You don't have any crisis in life. First you have to achieve those things, then only you can face midlife crisis. What are the fear in midlife crisis? Fear of becoming obsolete. जो बात हो रही थी कि अब नए लोग आ रहे हैं, हमारे प्रैक्टिस पे कैसा असर आएगा. टेक्नोलॉजी आ रही है, आर्टिफिशियल इंटेलिजेंस आ रहा है, इसके क्या असर आएगा. Fear of becoming obsolete, being displaced by younger and smarter generation, job insecurity, reduced energy level, financial issues, family commitments, retirement plan, and post-pandemic, there is a French word called Todesangst, that is a fear or anxiety of death that usually starts in midlife. What are the causes for midlife crisis? Number one is physical changes. Not as spry as used to be. उतनी फुर्ती अब नहीं है जैसी फुर्ती हुआ करती थी. पहली प्रॉब्लम physical. Susceptible to illness like hypertension and diabetes. These are becoming very common. What are the neurochemical changes? Hormonal issues, female, menopause, hot flushes, mood swing, sleep disorder, increased and unexplained overall stress. Male, decrease in testosterone usually starts at 30-40 years. Depression, low sex drive, erectile dysfunction, sleep disorder. That's the age where obesity, alcohol, tobacco, and drug indulgence enter into your life. Usually may evolve unless it is customary as prohibited by Islam. Usually men evolve like this. First, milk bottle by mother, and then daru ki bottle by yourself when you reach the midlife. Because you have nothing to do, you are not finding happiness in anything. आपका मध्य प्रदेश बड़ा हो जाता है, उत्तर प्रदेश खाली हो जाता है, दक्षिण प्रदेश में खराने लगता है. That is midlife. Evolution of women. Young fit girl, married, pregnant, small kid, grown up. Again she wants to be in the same phase as 17 years old girl. Then she starts shopping, going for hair straightener, which now has been banned by many countries for being carcinogens. I have already posted television debate on social media. And changing wardrobe, buying and compulsive shopping, that's a component of female entering into midlife crisis. There are 3 stages of midlife crisis. It's not a one-day job. First stage, trigger. There must be some trigger point. You have achieved, bought a house, good car, practice settled, triggering starts. Then it reaches climax, and after that, coping skill comes and start vanishing. What are the causes? Change in the family members. First is emptiness syndrome. जिनके बच्चे बड़े हो गए, घोंसला छोड़ के जा रहे हैं, तो पहले बच्चों की चिंता, इनसिक्योरिटी भी रहती है, चिंता भी रहती है, और एक उम्मीद जिससे उन्होंने सोचा था कि बच्चे को बड़ा करेंगे, बच्चे हमारे साथ रहेंगे, केयर करेंगे, ये उम्मीद और तमन्ना के बीच में बड़ा फासला बनने लगता है. एम्प्टीनेस सिंड्रोम, लोनलीनेस, फीलिंग ऑफ एम्प्टीनेस. Then change in relationship with partners, parents, like ill parents and passing parents, funeral, divorce, conflicting emotions, sadness, anger and confusion. अब इस emptiness syndrome एक generation, दो generation के बीच में कहा था, bridging between generation is midlife crisis. Your older generation and younger generation, you are struggling between the two. Career changes, there are repetition in daily tasks which causes boredom. On an average, career changes at 39 years of age, change in comfort zone, and new friendship and new circle, new colleague usually entered in that area. Change in financial situation, sometimes loss of job, disturbance in finance. There are 4 ऋतुएं होती हैं मनुष्य मतलब आदमी के लाइफ में. Young boy playing, enjoying, स्वच्छंद, उन्मुक्त, तनाव रहित. Now acquiring many of the habits today in technological era, screen habit. Then entering into professional life, and again into old age. Usually, female, young girl has different kind of early childhood, then involved in adolescence. ये हिंदुस्तान में मैंने भगवान ने देखा है सर, पता नहीं आपने देखा हो, किसी ने देखा मालूम नहीं. दुर्गा की जो मूर्ति बनाई जाती है, उसमें पता नहीं इतने हाथ होते थे नहीं होते थे, बायोलॉजिकली पॉसिबल नहीं है. प्रोबेबली इसी को डिस्प्ले किया जाता है. इंडियन वुमेन, वर्किंग वुमेन, स्पेशली डॉक्टर्स, डेंटिस्ट्री जो आप लोग काम कर रहे हैं, इतने हाथ दिखाए जाते हैं. प्रेस कर रही है, बच्चे को गोद में लिए फीड कर रही है, खाना बना रही है, कार चला रही है, योगा मेडिटेशन भी उससे एक्सपेक्ट किया जा रहा है, जॉब पे जा रही है, काम भी कर रही है. तो इतने हाथ शायद इसलिए दिखाए गए हैं स्त्रियों के दुर्गा के फॉर्म में. What are the preventive points? Way forward. First, set up your goal. That goal, domain of self, health, professional, educational, financial, family, materialistic, spiritual, and travel. First fix these goals in your life. And goal must be realistic and achievable. Don't compare with anybody else in the society. Accept change. Change is inevitable. First accept it. Make peace and keep peace with it. Make peace and keep pace with it. Acknowledge your feelings. Don't suppress your emotion. And fine, accept circumstances beyond your control. Ease into a new situation. Take bigger challenges into small steps. Like if you have to reach this height, divide into multiple small steps. And take lesson and ignore past mistakes. Usually, we are very much worried about our past mistakes. गुनाह. और हमारे अलीगढ़ियन ही हैं, मजाज साहब जावेद अख्तर के जो मामा थे, उन्होंने बड़ा अच्छा लिखा था, जिंदगी क्या है गुनाह है आदम, जिंदगी है तो गुनाहगार हूँ. Therefore, start ignoring your past mistakes. Just take lesson from them and ignore it. उन्हीं के एक्सटेंशन में मैंने लिख दिया, अगर मैं गुनाहगार हूँ तो तेरी है खता, अगर ऊपर वाला नहीं होता है. अगर मैं गुनाहगार हूं तो तेरी है खता, बूंद मेरी मिट्टी को फिर से बना लोगे. This is a stoic triangle of happiness. What stoic philosophy says, this is eudaimonia. This is the best with your inner peace. Is possible only when you take responsibility of yourself, be focused on what you control, and live with arate. Arate is nothing but living in moment to moment to moment. Don't think about the past, neither worried about the future. That you can achieve. Maintain a sense of purpose, try out something new, engage old interests, and embrace community services. Prioritize self-care. Set realistic exercise goals. Remember, you will not do same kind of treadmill and any exercise what you used to do when you were 20 years of age. Therefore, set a realistic goal. Unrealistic goal it cannot be achieved. Reassess your diet. Remember always, wholesome grain is wholesome health. Don't go for refined product like refined flour, refined oil in this age at least. Fruits and vegetables must be in your diet. Healthier alternative, choose from your own area because your consumption will decrease day by day. Avoid hedonistic eating. Hedonistic eating, I call it पिज्जा समोसा जैसे हेडोनिस्ट सुखवाद के लिए खाना, आनंद के लिए खाना मतलब हैप्पीनेस ईटिंग इज एक्चुअली यू आर लिविंग एंड ईटिंग फॉर योर भूख। और भूख के लिए मैं पहले भी बता चुका हूँ, भूख न देखे जूठी भात, नींद न देखे टूटी खाट, इश्क न देखे जात पूजा। अगर ऐसी भूख लगे तब खाना खाना है, अदरवाइज डोंट ईट। एडिक्वेट स्लीप इज इंपॉर्टेंट एंड मेंटल फूड must introduce into your life, that is reading. And remember, leaders are always leaders, but don't consider political leaders, they are not leaders. Adjust your perception to aging, practice gratitude, look to your accomplishment, find room for self-improvement and reframe setback. If you are helping someone else in midlife crisis, listen without judgment. Don't judge him or her. Listen problems that will help them. Be receptive to potential changes in your relationship. Keep close watch for signs of depression, persistent and daily. Spend more time together. Affirm success and express appreciation. To summarize, midlife is the old age of youth and youth of old age. That's nothing midlife. Dr. Yakma, you were telling about ergonomics. I always, at the end of presentation, when I am addressing the doctors gathering, I always talk on surgeon's ergonomics because I am a surgeon. But all dental practitioners are surgeons because you have to perform some. It's not just writing prescription. Eyes, shoulder, hip, elbow. These are the common points you have to always imagine on the doctor. Therefore, focus on the hip area. And remember, sacroiliitis is very painful when you progress in your life. This kind of sitting habit, anterior pelvic tilt and lumbar lordosis, leading a lot of pain, especially after pregnancy and delivery. This kind of sitting habit, surgeons sitting on the sofa, ill posture, on the mobile, lot of musculoskeletal degeneration and many problems. These are the common real picture of my operation theatre. After one surgery, I prefer not to sit on the mobile, relax, maybe concentrate, meditate, something like that, but not on mobile. Before starting operation theatre, this is picture behind the OT complex, where we do practice meditation, pranayam before going to the operation theatre or usually we sit on the floor, squatting after completion of one surgery for 5-10 minutes to stretch all the back muscles, starting with rectus, spine, hamstring, all the muscles, so that you should not be painful at the end of the day. And this is my team. Thank you so much. Om Sarve Bhavantu Sukhna Sarve Santu Nirayana Sarve Bhatani Pashintu Mata Santu. Any question can be asked?
Any questions from the audience? I think
I would like to just say something. Your presentation was very nice and it was quite attractive also.